Welcome, everybody. It's good to be here again. I introduced myself yesterday, so we'll get on with our introductions, starting with Twylla.
Actually, do you want us to introduce ourselves when we start speaking for the sake of time? Is that
Sure.
good? Well, I'll just introduce the objectives.
Yes.
Okay. You can tell we're feeling a little pressured for time anyway. But so you heard Richard, who has been our wonderful part of our system for many years, also introduce and kind of frame up this. And Mike is going to try to herd cats throughout this whole thing. You can see we have a lot of people and we're going to have to pass some mics and things, but we're delighted to be here today. And I just wanted to say we are a little messy panel because, hey, isn't every collaboration just a little bit messy, right? And that's the way it goes. And we are also missing some of our partners. We wanted to put a whole bunch more people on this stage. Our regional center partners, I know Tracy is here in the audience. We have some community partners. I know we have Koinonia here, and Tiffany's in the audience, and our Sierra Native Alliance, our Latino Leadership Council, our Sovereign Nation. There are a whole lot of folks that we wanted to also be here with us today. But you've got us, and you can see the objectives that we have here. But one thing that has been striking me as I've been listening to a lot of folks from a while, you are going to hear that this system of care has been in operation for over 35 years. And do we do it perfectly? No. Can we improve? Yes. Do we have to modify and change? Absolutely, with every new objective that has come along. But what you're going to hear over and over and over again is relationship building and relationship sustaining, and making sure that you always do that, because that's what puts this together. We do have a few other structural things to tell you about, a couple of those pieces, maybe a couple of the little roadmap pieces you were asking for. But for right now, I think you can see the objectives on the screen, and we're just going to go ahead and turn it over to Judge Nichols.
Okay, so first of all, I'm just a lawyer by training, so that means I have to stand up when I talk, and I have to have a pen in my hand. So, my name is Colleen Nichols. I'm the presiding judge of the juvenile court in Placer County, and I've been that supervising judge for 19 years, but I have been attending the SMART policy team meetings for 27 years. Almost 28, actually. So I am now the resident historian, although Rick Saletta is here back at the door, and he was on the team well before me. So how did it all happen? We've talked a lot. We're talking a lot, right? We're talking a lot. The question is, how do you put talk into action? How does it make it happen? I'm going to go back a little bit. I'm going to answer the last question that was raised at the last panel. If the legislature could just give us a little break and let us catch up on all the policy changes, that would be grand, right? Right? Here's another thing on that issue. I find it really difficult, and all my team knows this, to take any recommendations from the state agency about collaborations. So until the legislature and the state agencies can really show us collaboration by how they do it, and by breaking down the barriers between their agencies, how do they expect us to do it, right? So when that all started years ago, they invited me to this panel, which was probably not a good idea for them, and said, what could we do? And I said, well, first of all, I'm not taking any advice from you on collaboration, because we've been doing it for years, and you're just talking. So that's my framework. Now I get back to what I'm actually supposed to talk about, because I just get a little irritated. As the supervising judge or the presiding judge of the juvenile court, I am the chair of our SMART policy team. And what I want to give you is an idea of how this started. And I actually reached out to Judge Cousins, who was the one who started this whole process. I reached out to him on Monday. I keep in contact with him regularly. But as you know, our families don't arrive on our doorstep in nice, neat little packages with only one issue that needs to get addressed, right? You're all talking about, that's what we're talking about. So what happened is, in those days, the probation department and the child welfare department were saying, no, that kid belongs to probation. Oh, no, that kid belongs to child welfare. And what happened is the judge got mad, right? And he called a meeting and he said, these are our children and we are collectively responsible for our children. So I don't want any finger pointing. So that's how it started. And for those, most of you wouldn't know Judge Cousins, but when he got mad, his whole face turned red, and it was not pleasant because I was the recipient of that one time as a lawyer. And so the judge's role is really the convener, right? Because we are sometimes, to a certain degree, the, I can't think of the word, the beneficiary, right? So you, the agencies report to the court for those kids who are involved in systems and probation or child welfare. So we called a meeting, everybody attended. At that time, it was the Department of Mental Health. It was a separate department at that point for us. Now it's a part of Health and Human Services, child welfare, and reluctantly a bit probation. So probation was our initial reluctant partner. But after 6 months of hard negotiations, they came to our first MOU. That's not true anymore. Probation is no longer a reluctant partner. Reluctantly, because it was going to be a lot of change. And then about Rick made me know better. About 5 years later, education was brought on board as part of that SMART policy team as well. And we had a couple, well, the judge's role, again, is one, to make sure everybody plays well together. Sometimes I feel like I'm the chief cajoler, chief nagger, right? And that herding cats. And, you know, sometimes I meet with each agency separately. Sometimes I meet with them together, and then we have our regular meeting. So for the first 15 years I was on that committee, we met every Wednesday at 7:30 in the morning. And now we meet twice a month at 7:30 in the morning because our system is much more mature. What we ask our agencies is really to take this view that, again, these are our kids, our families, and our motto is you put your money on the table and your hands behind your back. Right? And that at times is hard to do. And sometimes there are legislative barriers that most of we've been able to fix. Twylla will talk about that later. We also ask the agencies to make sure that we're training all of our staff and to make sure that this is an institutional model, that we've institutionalized this collaboration. That, you know, I think all of you can agree that in this climate where there's constant retention issues of our staff, that has been difficult. We've had a lot of turnover and just trying to teach this system of collaboration. When we were years ago, we had some struggles in that, and so I had a saying that I didn't make this up, okay, which was that we will carry the sick and wounded, but the stragglers will be shot, right? So if you don't believe in this collaboration, if you don't get on board, then move along, because this is not the right place for you. Now, the agency directors couldn't say that, but I could say it, right? I could say it. Just as a reminder of that it was a commitment that all agencies in the court were really driving this home. I left my notes sitting on my office yesterday because yesterday was my day at the jail. No fun there. So it's really just been that constant driving, working with staff, training staff to do that, integrating our staff. And there have been times in our collaboration when things have been a little rough, and it has required a great deal of hard work. We go back to meeting more often, etc. It's about building commitment in the agencies from the top down, institutionalizing that commitment, developing trust between our agencies and leadership, and also getting the county leadership, your board of supervisors, everybody on board. We've been fortunate over the years. The Board of Supervisors has really allowed our policy team to drive all the policy for children and families in our county. You know, originally when we started, we were just talking about the kids that arrived in court, but that's not true anymore, right? Our system of care is far broader than that. And actually, the families and children that are served by our now system of care, the majority of those I never see in juvenile court. I never see them because they are served outside of the system, outside of the court system, right? So they don't ever have to they're not part of a dependency case or a juvenile justice case. I want to tell you that this great team that we have now requires little care and feeding on my part. The next big burden that we have is succession planning. I'm retiring in January after 30 years. So it'll be a big switch for everybody, but I promised them I would come back if there was any problems. So, Mike, I'll turn you back.
Thank you so much. Okay, y'all have heard about the ecosystem paper, right? You know what it is. Here's what we're gonna do there's a QR code if you wanna scan it or take a picture. What we're gonna do, we've presented a lot our Placer County system of care. And I looked at those presentations and I looked at the ecosystem paper and had this aha moment that we really fit into the recommendations that occurred after all the research that Jason and everyone has talked about. So we're going to organize today's presentation around those components, and our team will talk about each of those components and describe to you, so in your county, you can utilize the ecosystem paper as a framework, a design to help you move this forward. So why does the ecosystem paper map? It's a jumping off place to design your work. I get called all the time from counties saying, well, how do we do this? Where do we start? What do we do? This is a place where you could start. These fine people are going to show you how to do that. So we're going to launch back into vision, mindset, culture. We talked about it yesterday. Twylla, Indira, Lindsay, and Jina will get into the components a little deeper, starting with Twylla.
All right, so you can see on this particular slide, yes, we're on that right one. So shared vision and mission is absolutely key. So I wanted to talk a little bit. You all know what the definition of a system of care is. I can read it to you, but obviously it's broad, flexible array of services and supports for a defined population that's organized into networks, integrated care planning and management across multiple levels. It's linguistically and culturally competent, builds meaningful partnerships with family and youth, at service delivery levels, management and policy levels, and has supportive policy and management infrastructure. So one of the things that we talk about is how do we organize ourselves at all times around our mission and our vision? And our mission and vision is pretty simple. It's right up there on there. You can see it, and you'll see this over and over and over again in our presentation, is that we want to have kids safe, healthy, at home, in school, out of trouble, and then recently culturally supported. I mean, that is what we really want to do. So we talked a little bit about our memorandum of understanding. We'll talk about it a little bit more. We even have a little picture of it for you on one of the slides. It's from 1988. That's when we started. So I just want that to, resonate for some of you. 1988, we tried to start doing this kind of work. And again, as I said earlier, we're not perfect. We still need to be doing it better. But if we keep orienting ourselves to our mission and vision, that helps us. So you heard folks talking about education wanting to integrate with mental health services, and you have heard we want child welfare to play well with probation. We want everybody to play well with each other. So I had to list it out here. What we really do is we integrate our child welfare and children's mental health, by the way, in our county, similar to a couple. I know Tony's here from Yolo and a couple folks from Santa Cruz. I wear both of those hats. So it's my budget, it's my people, it's my figuring it out when I have a child welfare worker and a behavioral health person arguing about certain things. It can't be done in our system as well because we don't allow it because they're all in the same place. But how we are organized is we integrate our child welfare, mental health, probation, public health nursing, substance use services, education, all of our family and youth services, all of these together with our judicial branch, as we know. And then anybody else that we feel like we've missed, we regionally were like, recently, well, where's regional center? We've got to get regional center on board. And a few years back, we said, missing at our SMART table, at our SMART policy board, and so invited them in and are still working on that relationship very well. But all of these, so that we also work with our peers and our family, like I said. But a couple of the things you're going to be hearing on this particular slide and a little bit later, and I'll try not to repeat myself, is that there are certain things that go along with mission and vision. We believe in some of the structural pieces that you need to do are co-locating people. Now, the pandemic was really hard for this, but we have had a policy, and I know if there's any risk managers or county council in this room, they're like, how in the world do you get somebody who's a Placer County Office of Education person to be able to sit in and use the computer system and everything else in the county offices? How do you have probation in there if they're part of the county, but they're not necessarily part of that children's, you know, the CPS or the behavioral health system? How do you actually have people from Cal Voices and a nonprofit agency such as Sierra Native Alliance, somebody who does differential response for you, like Kids First? How do you actually have them all in the same office? Well, we do it. We've broken that barrier through our risk management and county council. And can you imagine if something happens with somebody on one of those sites, all the paperwork we have? Well, we just do it anyway. So that part is a structural piece that we feel is so valuable, is co-location, so that you don't have to go down to another building. You can make a phone call, yeah, or an email, but you can also turn around and find out in the next little cubby over and go ask them that question that you need to do it. It really does, by de-siloing actually the physical environment, that's one of our structural pieces. And training, you heard a little bit before, training together is critical, so everybody hears the same information at the same time. Our wonderful presenters right before this said that they did like a little cross systems kind of, okay, this is a little bit about us. You'll hear from me over and over again as well. One of the things all of our folks have to be is multilingual. And by that I mean, I need to know what policy issues are coming down for the probation department. I need to know, obviously, child welfare and behavioral health. I need to know if something is impinging on the court. I need to know what the new next legislative piece that's happening for our education department. We all need to know a lot about each other's system. It's not enough just to have a superficial knowledge. We have to know a lot, because what happens to one of us, a funding system, an initiative change, it happens to all of us. And then overriding all of that, and Indira and Lindsay, I know we're going to be speaking to this quite a bit, is our family-centered practice. So one important piece about that is you'll hear about our Family Resource Community Collaborative. This, for some of you who've had your multidisciplinary teams, we bring to bear all of our service sectors here to help our families and children figure out what it is that we can do next, how the system can help them, and they invite whoever they want to these as well. But one of the things that we found out as we went along with this journey is that having a system person facilitate this meeting wasn't good enough. We actually needed to have a family member facilitate this meeting. So that's why you'll see pictures in some of these. Our facilitators in the last number of years have been either Indira herself or Lindsay herself, as opposed to any system person. It makes the families feel much more comfortable, and it is really about them, right? So we need to make sure that that is at the center of our practice. So I wanted to say one other thing on this area too that I noticed from yesterday. Folks were talking about a lot about family voice and youth voice, and we had the wonderful folks from Sacramento, the youth. They were just great. And I wanted to say Placer does that as well. We have forums where we have family input. We've had some recent forums on youth input specifically about how and what they need in the schools. It was uncomfortable as anything. I can tell you, I was sitting there listening going, okay, yeah, what I thought was what they needed in the schools, they needed something else. And so it's important for us to do that. And then we also have a recent one, which was put on by our Hip Hop Congress, and wonderful creative ways of giving us input to what they also need, but that was more for community-based and health services. So I just want to make sure everyone knows that that is so important for all of us to do. Several people already talked about that. We need to center all of our practices around our families.
So that's a good segue. So the next critical component is community and families empowered to elevate their interest. Indira and Lindsay are going to talk about it. And just to remind my speakers, I'm going to be the time monitor. So be conscientious. We're at about 45 minutes left. So Indira, Lindsay.
Thank you so much. Good morning. I have a really loud voice, so I'll sit back here, but maybe Lindsay, do you want to? Okay, so I do want to introduce myself. My name is Indira Infante, and I am the program manager for Cal Voices. It's a peer-run agency here in Sacramento. And I've been embedded and co-located in the county for 12 years. I have the double experience of being a youth that was in the system in the juvenile delinquency back many moons ago. And then as an adult, became the caregiver of my brother who, was in the system, went out of state, was a very difficult young man, lots of trauma, all of that. And then I have also navigated and accessed services for my son now, who's an adult, through Alto Regional and other just mental health services. So I'm just super, super proud and happy to be able to sit alongside my colleagues here who are navigators for change. And also just when we talk about family-centered practice, it is just something that is the core of the work that we do as co-located and embedded partners, and also to have that lived experience to be able to work our teams. We invited our wonderful parent advocate here, Jina Coronado, who will also be speaking in a little bit, who has that true lived experience as a parent also, who's accessed services. But I use myself as an example of what an integrated system does benefit, right? And also, as Twylla pointed out earlier, Lindsay and I do facilitate the FRCC process for parents. We do call the families before to prep them. We ensure that our team members who work with us are also meeting with the families before that happens. Typically, the families are already receiving supportive services if they're already at that complex need level where there's a lot of different programs already involved with the families. I do want to add I'm bilingual, bicultural, living in Placer County, coming here from Mexico as a young person, not knowing the language, having to assimilate into this wonderful country with so many opportunities and also so many barriers, and just super thankful that we get to share our story with the people that we serve, and also that we're able to help and educate our actual team members about really what the struggles that families are really, really going through. I want to thank the panel before us for really highlighting that we're not making policies and change without actually asking parents and youth what they actually need. And sometimes the needs are so complex and so foreign, right, that it just takes so much effort. So I'm super thankful that all of you are here today to be able to continue doing that work. Did I miss anything?
Lindsay, do you want to add?
Pass it on to Lindsay.
Okay. I always love going after Indira because she makes my job easy. I'm Lindsay Alderette, and I run our youth peer support program called the Youth Empowerment Support Program in Placer County. And similar to Indira, I have my personal lived experience of being a young person involved in system services. So I was foster youth at the age of 14. I also had my own little run-in with probation. I navigated mental health services. And then also as a parent, I had CPS involvement in my life for several years. So there's a broad perspective that we as lived experience individuals can bring to the table. And I think one thing that I have always been impressed with during the time that I've been involved with Smart Policy is how valued that perspective really is. And that Indira and I are not just tokenized individuals who are present at the table, but our opinions really do matter, and the experiences that we bring to the table, not just our own, but I mean, I've been doing this 13 years, so I have 13 years of other experiences that we bring to the table as well. And it's always nice to feel like we are valued and honored for our contributions. So thank you to all of you.
So I'll just add on the slide up here, and I want to drive this point home, that Indira and Lindsay sit on our executive leadership team. So they're part of those weekly or biweekly meetings now. I'm sorry, not ours, theirs, because I recently left, but their leadership team. They're also on the management team. They or their staff are on the supervisor level teams. They or their staff are on the integrated kind of services team. So at every level of our agency, we have been able to support family youth voice at all levels. And that leads us to something we've been talking about, Family Resource Community Collaborative, and under this component, the commitment to address structural inequities, and Lindsay and Indira's facilitation of those. Our Family Resource Community Collaborative, Twylla talked about it a little bit. You all might know it as the ILT process, the Integrated Leadership Team process, but we've consolidated. IPC, sorry, my acronym's wrong. IPC process. And what we've done in Placer County to integrate that, we use it for other families who may not be at risk of foster placement. We use it for all of our high risk, high need families. So if there's a family who needs additional resources, supports, our juvenile justice involved, probation involved, child welfare, social services, we have this team there to help problem solve that. And so I'll turn it over to Indira and Lindsay to talk more about those processes too.
Okay, I'll take it away. Yes, and so as I was referring earlier to us being the facilitators and also working on those collaborative teams, one of the really important factors, I believe, that our team members, as Mike just highlighted, you know, my team is a team of 13 family advocates, parent advocates that are supporting through the beginning stages of families coming into the system. We also do, and I know Lindsay's team does as well, do receive community referrals from schools, other partners out in the community, but just that triage piece of hopefully if the process is working and, you know, probation, social workers, education, if they're, you know, if they understand, which most of them do, because that's one of the hugest pieces, I believe, of our responsibility of our work, to be educating new staff members that are joining all of these teams, to be able to ensure that they are referring families right in the beginning, to ensure that they're assigned a parent advocate or youth advocate with that lived experience. We have seen and we have heard parents and caregivers and supportive adults say, like, that really impacted like my, you know, participation into programs, and also when they do feel like they are being supported, that their voice is being, you know, held. I know earlier somebody said, and this is something that I live by, to say that parents and families and youth, they're the experts in what they need, right? We're there to sometimes kind of guide them to get to that place where they really understand, you know, what would benefit them, right? Because sometimes, depending on how the families are coming in, like we were speaking earlier, sometimes there's so much going on and there's so many barriers and so many complex needs that they do need that supportive structure of a team, really working ourselves out of a job, you know, and that's something that we say all the time, like, we're here to support you, to get you to that place of empowerment, so you don't need us. So when you're ready to fire us or kick us to the curb, it's good, we're happy. We don't want to be here. We want you to be connecting with your natural supports and, you know, really giving families that empowerment to be able to access their natural resources. You know, we meet families when they're, as you guys know, like sometimes at the hardest parts of their lives, right? Their children have just been detained. Their kiddos just went into inpatient. They've just been hospitalized for severe complex mental health needs. One of the things right now, and I'm probably skipping around, is we're also part of the mobile crisis teams. And so having people with that true lived experience to be there with the parent while the kiddo's being assessed. So I just think on all levels, like Mike was mentioning and highlighting, and Twylla always advocates that our voices are there to ensure that you know, we are able to not only explain the process to the parents, but also be that sounding board for them too, so that we are going back and telling our partners, like really kind of giving them that perspective as well, and being that a bridge for the system and also for the families that we're serving.
Lindsay, anything to add?
I'm not sure.
Judge Nichols has.
Do you have a question?
I just wanted to, on those, after the meeting, the joint meeting between all agencies and the family, they actually come up with a plan. And that plan lists out each person's responsibilities: the social worker's responsibility, the probation officer's responsibility, parent, youth. That report, if the child is connected to the court at all, comes to the court. It is integrated into their plan. So it's not just that they have the meeting. There is an actual document that comes from it. And it's very helpful for the cases that come to court, so that we know what actually does the family need and what priorities. Because, you know, sometimes the list is long and we have to say which ones are the most important, which do we do first. I just want to add that.
So I'll just add, so it's a plan that's influenced by youth and families. with youth and families in a meeting that's led by youth or a family member, an integrated meeting. So structure, organization, and resources is our next section. And Brian, Luke, and myself will talk a little bit about how we've organized and structured our resources. I think we're kicking it off with the probation department. Brian, do you want to introduce yourself?
Good morning, almost afternoon. Well, thanks for having us. I realize, can you hear me now? It's like I'm on Zoom or Teams and I just don't have my mic on. I realize you guys are a cool group. I didn't have to wear my tie today. So as soon as I leave, I'm taking this off. You know, like they mentioned before, probation was the troublemaker, not wanting to come together. But as you can see now, we actually benefit by this collaboration. We have access to so many resources working together with this group, because if you think about something, when I had a juvenile caseload about 18 years ago, I had about 100 youth on my caseload alone. Now we are about 100 formal wardship cases in total in the whole county. But with that 100 cases, all those youth and families have complex needs. So we need a team to wrap around to serve and support and to be available to help them. And this leadership team helps us stay focused and making sure that those resources stay open, that the access continues, that we're aware of new resources coming in, because I would like to say sometimes we're a resource-rich county, but keeping up to date on all those things with who they serve and what they're doing can be a challenge, and that's where we reach out to our partners. Each member up here has a different strength, and we can play off each other's strengths, which I have found to be extremely helpful. If I have a challenge, I have everybody's cell phone number. I can just text somebody. We do have, like on the board, it mentions multidisciplinary team meetings. We have a ton of those. But the beautiful thing about those relationships is when there's a time of need, there's something complex going on, we're able to get the people together that we need to and address the situation and pull a plan together for that kid and that family. There's no, wait until the next day or 2 days later, by then it's too late. Some of the great programs that we have in place that we have access to, because it's great to say you have them, but your kids truly have access to them. Wraparound, functional family therapy. We also have a co-located a clinician at our juvenile detention facility who is constantly meeting with our youth, developing safety plans, doing some counseling with them, setting up a plan so when they're released that they can be successful. And I have notes, by the way, because they didn't want me to go too long. As we mentioned before, we're a dual jurisdiction county, which I think is amazing because it doesn't just fall into one agency's lap. You're working together. Somebody is identified as a lead, but you're still required to come together and report back on that plan and what you're doing, who was responsible and who's following through. And part of that piece of this leadership team is it's just not the strength of the relationship with us. We roll them all out to our teams, and so our teams have those same relationships with each other. They're able to call each other. They're able to brainstorm situations. They're able to walk out because they're located in the same building, walk over and just reach out to somebody and say, hey, I have this complex case going on. What are your thoughts on this? Instead of us working in tunnel vision, we can get really lost sometimes when we're working cases if we're just trying to figure something out on our own. So they have that ability to do that. We also have a juvenile family treatment court, formerly called drug court. And that's a collaboration with all the members of this team. And we have seen some tremendous success once we integrated that program. It has things like wraparound, motivational interviewing, treatment groups, individual case management, parent involvement and support groups, community service, strength-based drug use education, fitness focus, where each of the kids get a gym pass, which is great because it's a good outlet for them. And staff are there working out with them. Those are just some examples of the things that we're doing together, not individually, to support these youth. And if you really want to see change and have outcomes, you have to be working together, because that's what it's really all about, right? Is to make a difference in these youth's lives, in these families' lives. Not to go through motions and say, I did this piece, I did that piece, I did that piece. What are we actually trying to do? And if you have a team approach, you have a better chance to work through that.
So before we jump to Luke, I want to punctuate something Brian said. A probation officer sitting in a cubicle next to a child welfare worker or mental health worker swings their chair around and consults on a support in a youth or a family or a child. Okay. pretty uncommon. What's not blocking the way? I can't talk to you. I can't do this. I can't share information. So it's an equal exchange of information on those teams. So Brian made it sound super easy. It took a long time to get there. I think Twylla might talk about it in a minute. But you can literally go in and see this exchange and who else is on those teams. And you'll see a picture in a few slides. Family members, all sitting around. You don't have to go to a special silent room with the noise canceling machine. We're able to exchange that conversation to help create a better plan for and with the families. Luke, do you want to talk about the education department?
Sure, Mike. Good morning. So my name is Luke Anderson. I'm the Executive Director for Prevention Supports and Services at Placer County Office of Education. And I came into this role came to Placer County Office of Education 8 years ago, having worked in a large school district. And one of the things that I'm well aware of is that education, I think we really benefit from this collaboration. So in education, students come kind of no matter what, right? So every student is our student in public education. And their needs come with them to school. And the better we can help create a system and support a system where those needs are met in an efficient and effective manner, really the better we benefit. But I also acknowledge that we're not really set up to do this. So starting from how we're educated to how we're organized. And so we have to overcome some barriers to make this happen. And I just wanted to touch on a few that I think we've pushed on in our department. One thing that we ask of our leaders in particular is we ask them to decouple from their professional role. So as we talk about the policy-making process, one of the things that you hear a lot is such and such professional organization came and lobbied for this, and this organization came and lobbied for this. We ask our folks to not see themselves as school psychologists or school social workers or teachers, but part of a system and a leader within that system. And I think that's a really hard thing for educators to do because we're in a system where our education is part of our identity. So that's one of the first things we ask. The other thing we ask is that they focus on adding value. So if you're going to decouple from your professional role, what do you couple to? And that ask that I ask of my folks is to look for value. How are you going to add value within this collaboration? Again, we sit in a slightly different seat. Education's organized differently. There's 16 school districts in Placer County. They all have a school board. So we have to acknowledge that. And then the last piece, and Mike mentioned it here with the co-location, is we have to really trust our people. So I have staff that are out and they're not on our computer system. They carry a system of care computer. They carry a system of care badges. So I don't have a system of care badge. I can't go fob into their office. So I have to trust that Twylla and Brian are there to support them and that they're helping to set the expectation and the direction for that work. So within Placer County Office of Education, we are lucky enough to be collaborative members on a number of initiatives. One of them I just wanted to touch on is our commercially sexually exploited children project. So that work is happening, and within our role, we have to think about where do we add value in that role. We do not carry badges. That's Brian's job. We don't intervene from a child welfare perspective. So where do we add value? And I think there's two places that come up over and over again in this work for education where we add value. One of them is reach. So great thing about public education is everybody comes to us, right? At least when they're attending school. So we have an opportunity to do prevention work that some of our system partners might find more difficult because we touch so many kids. And the other piece that I think we add value to is teaching, right? We come from education. So when there's work that needs to be done, if it's suicide prevention and we need to educate folks, or we need to educate families on the risks of CSEC, that's a great opportunity for us to come in and add value. So we've tried to do that in our CSEC work through MHSA. Again, where do we add value? Reach and teach. And so we just keep looking for opportunities to do that, partly because we don't want the judge to leave us behind.
So I'll add a little bit. Luke mentioned carry a system of care computer. Mm-hmm. On that system of care computer is access to the Child Welfare Information System. So CWSCMS, some of you may know it as. Our staff can go in, look students up, add to the plan the educational record, which is called
The Health and
the
Education
Health and
Passport.
Education Passport. Thank you. And have that access. So again, not having communication be a barrier. We'll go to capacity building now and capacity building, technical support, research agenda, building a local ecosystem of care. And Luke's going to talk about that a little bit as well.
All right. Thank you, Mike. So the capacity building piece certainly is important. And again, so many of us are not educated or expected to do this work. So a lot of the capacity building has to be done within our systems and through our own leadership. I know for me in the years leading up to Mike's retirement, Mike was taking me to meetings. We've probably had countless conversations on what does this look like? Because Mike knew that nobody trained me on this. Nobody sat me down while I was at university or my past job and said, you know what's really important is having a functional system of care in Placer County. So it was his job to teach me that piece, and then it was our job, and it's now my job to teach our managers and our leaders that. So we have system of care. We put the vision and mission in our leadership meetings. We talk about that. As we write our mission, we do that not as educators, but part of that system. So we look at what is the vision mission of Placer system of care and smart policy, and we write to that. As we establish our operating principles, same thing. So we do primarily two big things in our department. One is we provide professional development, so training, and then the other is we provide student services. So right now we're in the process of writing down what our philosophy is with that respect. So what is it that we do, who is it that we are, and what is it that we expect of our leaders? And when we provide training, what does it look like? And what does it look like when we serve students? So we need that system of care language in there. We need the language of collaboration in there. And we really work from that perspective. And then just lastly on the research piece, if we really do care about adding value, we need to start measuring value, and we need to start measuring implementation. So that becomes really important. There were some conversations earlier around, do we try to implement too many things? One of the things that we believe is the more you measure implementation, the more you realize how hard it is and the fewer things you will do. So that becomes a big part of the work as well. I think that's probably where I would close on that. I know we got to move it along here.
So the next thing that I want you to look at as we move along in the ecosystem paper is you consider working in your own counties, on your teams later today in conversations, is the larger culturally responsive and congruent behavioral health workforce. I think Placer's done a great job at getting us there. It's not easy. It happened over time, 33 years in our system of care. I have the first MOU actually sitting on my wall at home all the way to today. It's changed a lot. So Twylla will kick us off, and then we'll move to Indira and Jina.
So I know, again, for time, a couple of things that I wanted to say here are we ask a lot of our workforce. We ask a lot of anybody that comes to work for us, whether it's a probation officer, anybody that works in our schools, anybody in child welfare, behavioral health, because you heard me say earlier about being multilingual. We require that of everyone. So they can't just be a social worker in our system. They have to know something about behavioral health. They need to learn something about probation. They need to know, obviously, CSEC kind of language. They need to know something about substance abuse, foster placement, diversion. We expect it of all of our folks. And guess what? They don't always stay. This is a lot to learn. It's going to be a lot if you want to have that congruent workforce as well. Now, what's kind of good and bad sometimes about that workforce is that they see opportunities over in the school, for example, or maybe they decide that they really don't like social work as much and they really do want to have a badge. We do have a lot of shifting and moving parts in our system, but it also offers opportunities for people to find their niche, right? To find that what they want to be the specialist in, but they still have to actually know about everything else in our system. And so that's one thing I just wanted to say again about being system multilingual. And then we talked a little bit about some of our integrated teams and our child and family teams. And for those of you that are in the child welfare behavioral health world, you know that we're required to do some of those, but that wasn't a requirement for a long time. And we've always done CFTs, child and family teams. Some of you will be old enough to remember when we talked about team decision making, and some of you, well, Rick is probably rolling his eyes back there. But we've done so many of those types of meetings for so long. That's one of the pieces, the structural pieces that keeps us together. Now, if we get to have a little bit of time later on, I know we have a couple more slides on structure that I want to emphasize a few things, but right now I also want to turn it over for that culturally responsive and congruent workforce to Indira, I think, and Lindsay and Jina for sure.
Yeah, why don't we kick it off with Jina? She hasn't had a chance to talk yet. Jina?
Hi, my name is Jina Coronado, and I am a family advocate with Cal Voices. I've been here for 2 years, and one of the unique qualifications for my job is to have my own lived experience. I come into this with, I have 5 children. I'm mostly a single parent, and my kids range in age from 14 to my oldest is 26. And I have had, my 14-year-old is autistic, and I've had to deal with, education, working with IEPs, and kind of navigating through that system, mostly on my own. And then I have my 4 daughters. 3 of them have, I've had to work through mental health services for them. One of them tried to dabble in probation. Luckily, she did not make it. And she actually works for the YES program now, and as a peer advocate. And but one of my daughters in particular, she is 19, and she has struggled with mental health challenges since she was 12. She has been in and out of hospitals. I can't even count the number of times that she's been in hospitals. She has actually attempted to take her life twice. And as a single parent, I have a lot of natural supports I'm the oldest of 7 children. My parents are educators. I come from a family I have a lot of support. However, going through this, it was very feeling alone. And, because I didn't have anybody else that was in my life that was dealing with the same things that I was dealing with my daughter. And I had to learn how to kind of navigate through the system of trying to find a psychiatrist for my daughter when she was 12. And that was very hard because it's very hard to find a psychiatrist for young kiddos. And, I was lucky to kind of live here in Placer County, move into Placer County when she kind of first started going through some of this stuff. And I was able to kind of navigate through the different finding her therapist and doing all these different things, but still feeling alone and kind of just not having that support. And I remember one of my low times of sitting in the hospital with her and just really feeling like I was a failure as a parent. And, what did I do wrong? Why couldn't I help her? Just all these different thoughts that go through your head. And a social worker came up and she was talking to me and she said, hey, Mama, you're doing a really good job. And, I had that support from my parents and family members and stuff, but hearing it from someone that didn't know me and just knew the things that I had been doing of just trying to go through and help find a therapist and help find support groups and help, but just all these things that I was trying to do for my kiddo to keep her healthy and safe. Just those words right there, it have stuck with me. And it really kind of helped me like, really? You think I'm doing a good job? Okay. And, okay, I can keep going. I can keep moving. And, I really held on to that. And, prior to me doing this job, I used to do behavior therapy and, mostly with autistic kids. And I, was trying to be there as a support for the parents. And I've just kind of always been natural with that. But getting this job and working in Placer County here, is just amazing. And the amount, they all talk about, sitting at your desk and being able to turn and, ask somebody, from Placer County Office of Education or ask a probation officer or the health nurse something when you're trying to do something for one of your families. And literally, I have a PCOE representative right in front of me, and next to me over here is the health nurse, and I can just, if I need anything, if I'm looking for something, I can go and reach out, and it's just amazing how we all work together. And now I'm part of a mobile crisis team, and I get to go out with a clinician, and we go out when families are at some of their really low times, and sitting there, and I get to sit there with the parents and the families, and I hope that I can be that support for them to help offer that little bit of hope and that little bit of resiliency, and letting them know that, even though this isn't a good time right now, that we're going to keep moving, we're going to keep doing together, and I'm going to be there and do what I can for them, and know that if I can't find the answer to something, that somebody in my building will be able to help me with what I need to do for this family, because that's what it is about. It's about our children, and about the families, and working together and meeting, we say it all the time, is, we meet these families where they're at, and everybody comes in different, and everybody has different needs, and nobody deserves to feel alone, and nobody deserves to feel like they're not worthy and not worth it. And I love that I'm able to do that with these families, and I love being part of this team.
So in the last minute in this section, Lindsay, do you have anything to add?
I wasn't prepared to add anything.
Okay.
But one thing that I wanted to emphasize, we've heard multiple times the relationships, the trust. We've spent a lot of time building relationships so that it makes everything else run smoothly. If you think about how you make a machine work, you've got to massage it, right? You've got to nurture it, you've got to oil it. In order to do that, you have to have a relationship with all of the key players. And that relationship piece, it really does help make things run smoothly.
Thank you. So in our last section, about the last 10 minutes or so, FYI team, structure, organization, and resources, we're going to talk a bit about community-defined shared outcomes, accountability, and continuous improvement. So this has been a topic, a thread throughout the symposium so far, but I really want you to think about that, and particularly resonate around shared outcomes and accountability. I believe it was Judge Nichols or Twylla who mentioned a plan is created for the court. We go back to that social worker who's written in that plan that's supposed to connect the family to therapy and say, did you do this by this date? So it's what's going to be done, when is it going to be done by, and we're going to check back to make sure you did that for the family. And there's accountability around that. If the probation officer didn't do something, I'm going to I would have called Brian. Now Luke's going to call Brian and say, hey, did your probation officer do this? And follow through as needed. So I'll turn it over to Twylla.
We said most of the things in this area in terms of structural things, mission, vision, always having that at the forefront, family-centered, structural changes, co-location, all of those sort of things. One thing that we haven't mentioned very much, and we'll get to it in a minute as well, is we share and braid funding all the time. And I know we said you need to bring your money to the table and put your hands around your back. We really do it all the time. We also try to push the envelope. If Elizabeth is in here, I'm sure, that whole HIPAA, FERPA stuff. We try to find opportunities to share information when we need to, for the good of the family and the child, as long as they know that we're doing that, right? So that's one of the structural pieces as well. But when we talk about braiding funding, I know Brian is going to talk about one particular program here in a minute, and then I'm going to jump back in and tell you actually how we fund that particular one. But Richard also wanted me to say, with our family and youth advocates, that there might be a question about how we fund them. We don't fund them out of child welfare or probation. We fund them through Mental Health Service Act funds, and before that, we used child welfare funds, and we might have used some federal mental health funds. And I hate to even say that, there's policy people in the room, but they were part of our plan, and we just figure it out. And if we lose one funding stream, we figure out another way to take advantage of it. So I'm going to turn it over for sake of time.
All right, so we'll go to Brian and I believe Luke to talk about effective approaches at integrated funding. How do we make this happen?
Like Twylla mentioned, one of the great things that we have is our Crisis Resolution Center, which is an amazing partnership that we all have with Quintanilla. It started back in 2002. It's a 6-bed home-like environment for youth. So, for example, if you have a kid that's struggling and there's issues going on between the kid and the parents, instead of trying to get law enforcement to respond, to interact and find some kind of law violation to try to book them in the hall, we have this home that they can go to, that they have staff 24 hours that will work with them and work through multiple phases to get them reunified back at home, while providing resources and services for them. You can also utilize that center they have a 24-hour hotline, so parents can call at any time, because, it doesn't happen just between 9 and 5, those banker hours. And then also they have an out client program. So they're not going to just go, when you call, yeah, let's bring them in. Let's see if we can work through it first and keep them home. And let's talk through this a little bit and try this. But not, then we'll bring them in. But if we can keep them home, they're going to do that, and they're going to follow up with the resources and making sure they're handed off to where they need to go, because that's really a key ingredient with all these things, is having providers like this who make sure there's a connection to, if they're not providing it, to the next place that it is, versus saying call this number and show up, because we know where it goes from there. I know we're short on time, so I'll turn to Twylla.
So the one thing I wanted to jump in here is these are all pre-system kids, right? These are not kids that are in juvenile justice or child welfare or anything. But the funding for this is, does anybody know about the JJCPA funds? This is Juvenile Justice Crime Prevention Act funds, have been funding this for years. Yes, there's a couple people. And we also do it through federal mental health block grant funds. So talk about a creative way that we've written those into our funds. We're not using anything else for these. We're not obviously using, because they're pre-system kids. So it's a hospital diversion program as well.
There was a year prior to Brian and Twylla, where, and I don't remember the circumstances, why the juvenile justice funds were stopped abruptly. So like in May, they said, you're not going to get these funds in July of next year, which, for a $750,000 project is the end of that project. And I was the probation manager at that time. I went to the director and said, well, we're going to have to close it. I have no money, like literally no money. And he said, you're not going to close it. We're going to transfer funds from system of care to probation to run this for the next year, while the state sort of sorts out their stuff and initiates as funding. That's a big deal. Like, you go in the office and literally Bud Batista said, here, Mike, here's $750,000. Keep it going. Luke, anything to add there? Oh, okay. So moving on to
Sorry, Mike, real fast. Just on that, back to that slide, that's actually a picture of the front of the house right there.
It is.
Just so you don't contest, it's an actual home.
Tiffany is the executive director of Koinonia, and she's in the audience. And anyway, she's here. Hi, Tiffany. And it is a great house. It's wonderful.
You are literally walking into your grandmother's house with quilts on the couches and this, I swear to God, smell of cookies in the air. They must have a candle or something, because I never got to eat a cookie, but when you walk in there. So data information sharing is always on our minds. Twylla, do you want to tee us up there?
So I'm going to try to do this fast. So you've heard about our continuous MOU that we've had, but the other thing that Placer received way back when is we had a Placer, what we call the Placer waiver. We literally had legislative action to allow us to organize the way that we are. This allowed us to braid funding. This allowed us to braid our data, not all the systems, just the data, braid how we actually do our work together. And we re-upped that legislation up until about 2015, 2016. It was sunsetted. And if you look up Placer waiver, it is a permanent addition to the Welfare and Institution Codes that, again, allows us to be organized in this manner. So the structure is there for us, the legislative structure to do it, but it takes all of this will to do it. And for the example that Mike gave about losing funding in one area, we have 20 other examples of one of our other partners who lost funding in some way, and then we figured out a different way to fund that particular program, because we felt not only that it was important, but her community, more importantly, felt that it was important. So the Placer waiver is a huge thing. Again, do we have to do it this way anymore? No, but it allows us to do it. And so we also heard, and there's going to be, I'm sure, a wonderful presentation a little later today about a data dashboard. We have had an outcome system that we have had for probably, 25, 30 years. And again, it's organized, as you guys have heard, around our mission, vision, and values. So it talks about safe, healthy, at home, in school, out of trouble. And what we do is, while we can't merge the databases, what we do is we extract the data out of each of our databases and put it together so that we can say, okay, how are they doing in school? How are they doing in terms of their graduation rates and educational attainment? We also have how healthy are they, because we're a health and human services organization. Then we have access to all of our public health data, teen pregnancy data, different things like that. So we put that together along and aligned with our mission, vision, and values to ensure that we can see some of those outcomes. Now, there's so much more. We need to do more, but sometimes it is overwhelming because being this system, we have access to a lot of data. So sometimes it's trying to figure out what makes the sense for us to be putting together to organize ourselves, and that's when we go back to the mission and vision. So I'm excited for the other dashboard presentation, and we know that we can always improve.
So lastly, to bring bringing us home, and what I want you all to think about as you work later, work on your teams, and think about your integrated systems and the ecosystem paper and how it can support you, is coordination or coordinated care and navigation for children, youth, and families. And I think you've seen kind of a general overview of that. But I'll have Twylla kick us off, and then maybe hear again from Indira, Lindsay.
And Mike, I think you and Judge Nichols actually did this pretty well when we were talking a little bit earlier, is it has to go at all levels of the organization. And maybe, I think, Luke, you were saying that too. It has, we have family members, as Indira said, and youth on the executive team, our leadership teams, our management teams, our supervisory teams. Every team that we have is organized in the same way. So everybody has that kind of integrated systems. And then, as you've heard from Jina, you can turn around and talk to a public health nurse or talk to a probation officer. That's how our teams are organized as well. They're integrated teams, and we operate then in that cross-system multidisciplinary function. So we don't just come together to do that. That's just how we actually operate. So I mean, just in the interest of time, just to let you know, that's really throughout the entire organization. That's, as you can probably tell, that's how it's difficult sometimes for our teams to be, oh, what did I actually sign up for? I have to learn all this too, and I have to integrate with all of them. But as Brian said, then you get access to a lot more when you have partnerships that are so close, and that you can just get to folks and everybody's bringing their resources to bear on a particular program. So we always talk about how can we share, right, information, data, resources, as opposed to anything else.
So lastly, last example, I think, and Indira and Lindsay are both involved in this. Who has truancy as a problem in your county? I think epidemically across the state, attendance in school is a problem. We came together to solve that problem. Our youth partners, our family partners sit on our student attendance review board. So it's not like we're going to get you on that board. We're going to help you. And there was still a gap in connecting to community-based agencies. So child welfare said, Mike, we can fund Kids First as a community-based agency in Placer County to also sit on your board to help be that warm handoff to the community resources, not just Kids First resources, but any resources, and then they fund that. So last closing thoughts. I know I'm not even looking at them. So, yes.
One of the things that I did want to add, I did mention earlier about bilingual bicultural services, and I know also Twylla mentioned our community partners, Latino Leadership Council. We're also working with all of our other partners to ensure that we are supporting other cultural groups out in Placer, and really kind of navigating how to access and provide services for languages that we don't have cultural brokers already involved or embedded in the system. And one last thing I'll say is with capacity and time, and Twylla, thank you for highlighting how It is a lot for the workers when they come, or the new probation officers. I've heard this. I've been there 14 years working alongside. But the way that I explain it to them, it's like it's an investment. Like, it might take you a little bit longer in the beginning when you have to collaborate and do all this like meetings with these teams, but at the end of the day, it's going to help that family succeed and have better outcomes. So it's worth it. It's an investment. And that's the way that that's the last thing I'll say, that all of us working together, it's a huge investment for positive outcomes on our community. Thank you guys so much.
So here's what we're going to do. Placer sits in that back corner, which is interesting that they put us right by the door in the back. But as you go to that back right or left corner exit, they'll be there to answer questions. If you have comments, come see us. I'll be around the room. They'll be here today. I'll be here tomorrow too. And thank you all for your time.